students, we are continuing with the Clostridium species that is left because we have finished Clostridium perfringens and Clostridium tetani. So what is left is botulinum and difficile. So both of these can also be probable questions. There's chance of getting questions from this part. So coming to Clostridium botulinum, as in the first class of Clostridium, we have said botulinum is the which causes a very severe form of food poisoning called as botulism. So like other Clostridium, this one is also widely distributed saprophyte which is present in the soil, in the animal manure and vegetables and sea mud. And this causes a very severe form of food poisoning that is named as botulism. So there is no difficulty in remembering botulism is caused by Clostridium botulinum. So like the other Clostridia, this is also obligate anaerobe. Remember, this is obligate anaerobe. So that point should be definitely there when you write. And it's a gram-positive bacillus. There is no capsule. And this one is also motile. So the only exception for motility among Clostridia was Clostridium perfringens. That was non-motile. And this one, like perfringens, it produces subterminal oval but bulging spores. That is the difference. It produces, so the bacilli will look like this since it is having a very bulging spore. That end will be looking like this. Now the peculiarity of the spores produced by botulinum, they are very highly resistant spores. They can resist heat for several hours. So that is why it is a little difficult to eradicate the spores if it is present in food and all. And there are 8 serotypes for this particular bacteria. A, B, then C1 and C2, D, E, F, G. So you have A to G with C1, C2. So 8 serotypes are there. So we'll see how this particular bacteria causes that severe form of food poisoning called botulism, and what is responsible for this. Like what you have seen in perfringens, it produces toxin. Tetany produces toxin. Similarly, botulinum also produces a toxin, but this is one of the most powerful toxin produced by any kind of bacteria. It is very highly toxic and lethal in very minute quantities. So it's a very powerful exotoxin. And among all the serotypes of Clostridium botulinum, the 8 serotypes, the type A toxin is the most potent toxin. So this is a very potent toxin. And actually this toxin is secreted in a progenitor form. And then it is converted to active toxin by the trypsin and other proteolytic enzymes of the intestine. So in food, it will be produced as a progenitor toxin. And when you consume it, our own enzymes will make it into an active form. So this toxin, why this is very potent? Because even if it is coming through food, it's a neurotoxin. It acts on the central nervous system. Like what you have seen for tetany, it was acting on the presynaptic inhibitory neurotransmitter release is blocked. But here what they do is they block the production or release of acetylcholine at synapses and neuromuscular junction. So this is blocking the release of your acetylcholine, which is the very important neurotransmitter. So if this is blocked, what happened? There is inhibition of transmission of the signals. So this signals neurotransmitter release is blocked. It will block the release of signals at the synapses and the neuromuscular junction. So no excitatory stimulus is coming to the muscles. So there will be muscle flaccidity, paralysis. This is what happened in botulism. So there is paralysis, flaccid paralysis in botulism. Now this toxin is relatively stable, and the preformed toxin in food, it can be destroyed by boiling for 20 minutes. Note that you have to boil for 20 minutes to destroy the preformed toxin. So you get this botulism or the food poisoning caused by Clostridium botulinum when you consume food which already contains a toxin, preformed toxin. And this toxin can survive heat for some time. That is why this is very difficult to eradicate in food. We have basically 3 types of botulism. The one we are talking about, the foodborne botulism. Then the other 2 forms are infant botulism and wound botulism. So first we'll see the foodborne botulism. That is what is more important. This is because you consume preformed toxin in food contaminated with Clostridium botulinum. Suppose the food is already contaminated with botulinum spores. If it germinates and produces toxin, which toxin? The most potent one is type A toxin, but any of the strains can produce toxin. So it is produced as a progenitor form. You consume it and this goes into your intestine and gets converted to an active toxin. Incubation period for this is like 12 to 36 hours. You develop the symptoms, you start the symptoms by 36 hours. So what will be the symptoms? Initially, it will be intestinal symptoms like vomiting, constipation and all. But later on, it move on to the paralytic symptoms like ocular paralysis, ocular paresis, leading to diplopia. You will have double vision. Then you have difficulty in swallowing. dysphagia, that is called as dysphagia. No, difficulty in swallowing is called dysphagia. You have difficulty in speaking, that is called dysarthria. So this is the triad of botulism: diplopia, dysarthria, dysphagia. This is because of the paralysis of the muscles, of the ocular muscles, the your muscles which are involved in swallowing and speaking. So all the pharyngeal, laryngeal muscles are involved, and finally it can lead to airway, breathing difficulties. The respiratory failure can happen when the disease progresses. So the fatality rate is like 25 to 70 percentage, and death is due to respiratory failure. So this is a very fatal condition. So that is basically a paralytic type of illness that occurs following consumption of food contaminated with the toxin. Now, what is infant botulism? It's otherwise called as floppy baby syndrome. This is due to ingestion of food not contaminated, not which is already containing toxin, but which is contaminated by the spores of Clostridium botulinum. And this is very commonly implicated in when you give honey to newborn babies. So there was a practice before we give this honey, which is not at all not at all sterilized, or it's not a sterile thing. No, you give raw honey to infants. If the honey is contaminated with spores of Clostridium botulinum, there is chance that these babies can develop infant botulism. You call it as floppy baby syndrome because there will be paralysis and the child muscle tone will be very low, and that's why it's called floppy baby. And neck will be like paralyzed. Neck won't be will be very floppy like appearance. That is why it's called floppy baby syndrome, and it affects infants. Now they exhibit flaccid paralysis, that is floppy neck. That's what I told you, floppy neck due to the generalized loss of tone. Initially, it will be the neck muscles which will be having a loss of tone. Then it progresses to all the other muscles. And since they are having very low muscle tone, they will be having very weak sucking response. They can't suck milk. It will be very difficult, and they will be constant crying, respiratory complications. So all these are the sequelae of infant botulism. Now, what is wound botulism? When a wound is contaminated with Clostridium botulinum, it's a very rare condition. Toxin will be produced at the site of the wound, and it is absorbed into the blood. So there won't be any GI symptoms. The toxin is directly going into the blood. It will directly cause the neurological symptoms. So GI symptoms will be absent in wound botulism, but this is very rare. So even if you don't remember about wound botulism, it's fine, but you have to remember about the foodborne botulism. So the drooping eyelids, diplopia, difficulty in swallowing or dysphagia, dry mouth, facial weakness, later on leading to respiratory difficulties. Initially, they will start with nausea and vomiting. That will be the first symptom that comes because it goes to the GI tract. Finally, absolute generalized paralysis will be the sequelae, and respiratory failure is the cause for death. So those are the symptoms of botulism. Now, how will you diagnose botulism in laboratory? You have to take the specimens. So what will be the specimens? If a group of people developing symptoms after consuming certain food, you have to take the suspected food. Otherwise, you can take the patient's feces, or vomitus also can be a specimen. And what will you do with the specimen? You can do staining, you can do culture. When you do gram staining, they will show gram-positive sporing bacilli like this with bulging spore, subterminal spore. And what you do for culture, like other Clostridia, you do culture in Robertson cooked meat medium, blood agar. Remember, this is also a strict anaerobe. Now, what you're going to do for treatment of botulism? You have to prevent botulism, you have to treat. So how will you prevent? You have to prevent contamination of food by this Clostridium botulinum. And this is very common in improperly canned food, improperly preserved, improperly canned food. So you have to be very careful when you take the tinned or canned food. That is a very common source of botulinum toxin, botulinum poisoning. So when suppose a patient develops the symptoms of botulism, you have to give intensive supportive therapy. You have to maintain the airway, breathing, circulation, everything should be maintained. If outbreak occurs, suppose a group of people who consume this food is developing similar symptoms, you have to give a prophylactic dose of antitoxin intramuscularly to all who have consumed food. That is how you can prevent. So basically, it is a supportive treatment that we can give suppose the patient already develops botulism. So polyvalent antiserum to types A, B and E may be given. That is an antiserum which is available. We have 8 serotypes, but A, B and E are more common. So we have polyvalent antiserum for anti-A, anti-B and anti-E. So that can be given for treatment. And I've told you the very important thing is supportive treatment with the maintenance of respiration. That is very important. So that is about botulism. So it's a food poisoning, but it's a neurotoxin causing paralysis. And it's a preformed toxin. That is one thing you have to remember. So you have the symptoms very fast, like 12 to 36 hours, you develop the symptoms. Now coming to the last one of Clostridium, that's called Clostridium difficile. In the first class of Clostridium, I told you difficile. Why it is called difficile? Because it's very difficult to culture. That's why you call it as difficile. So the spores are present widely in hospitals or the hospital environment. So that is why this is very commonly associated with hospital related colitis. I mean, hospital related means patients who are hospitalized for prolonged duration, who is on prolonged antibiotics. What will they do? The antibiotics will destroy the normal intestinal flora. And this point of time, if they have acquired the spores from the hospital environment, spores have entered the intestine and colonizing the intestine. If the normal flora is destroyed, these spores will germinate and they will elicit their pathogenicity. They will cause the disease associated, that is, it will cause colitis and lead to diarrhea in the patients who are consuming antibiotics for prolonged duration. So prolonged hospitalization, prolonged antibiotic therapy are the risk factors for Clostridium difficile colitis. So you call that colitis as antibiotic associated colitis or pseudomembranous colitis. So this is also gram-positive bacilli, spore forming. The other additional points that you can write, strictly anaerobic, all these are applicable for difficile also. Long, slender, gram-positive bacillus and with oval and terminal spores. That's what I told you. Now, coming to the pathogenesis and virulence factors, like any other Clostridia C, this is also toxin producing. And what are the two types of toxin that difficile produce? It produces toxin A and toxin B. Toxin A is a enterotoxin which acts in the intestine causing diarrhea, and toxin B is a cytotoxin which can cause destruction of the cells. So toxin A, enterotoxin, is responsible for diarrhea, and toxin B, cytotoxin, is responsible for the cytopathogenic effects of this bacteria, leading to pseudomembrane formation. You know, when this bacteria produces this cytotoxin, it can cause destruction of the cells in the colon, and that can lead to necrosis. And all these necrosed cells, inflammatory cells, everything will together form a pseudomembrane which covers the colon. So it's called pseudomembranous colitis. So the two conditions that you have to remember, diarrhea and also pseudomembrane which is covering the colonic mucosa. So that is why it is called as pseudomembranous colitis. So sometimes the question can be in this form, pseudomembranous colitis. You have to remember it is caused by Clostridium difficile. So you can see the Clostridium difficile spore which is present in the community, in the hospitals. It can be normally present in animals and all. So when this enters, germinates, producing the bacilli, initially it will colonize the intestine, and when it has a favorable environment devoid of the normal flora of the intestine, it will produce toxin A and toxin B. Which one is enterotoxin? Toxin A is enterotoxin and toxin B is cytotoxin. So that is how you can remember BC. B is cytotoxin. So what is A? A is a enterotoxin. And what will it cause? It will cause diarrhea and it will cause pseudomembrane formation, colitis. So how will you diagnose Clostridium difficile? We can do culture. What culture? Stool culture. See, this is very difficult to grow. That's why it's called difficile. You have a special kind of medium called CCFA, cycloserine, cefoxitin, fructose agar. Cycloserine, cefoxitin, fructose agar. That is a special medium for difficile. And other than that, the better method to test for difficile is you can detect the presence of toxin, both the enterotoxin and cytotoxin, in stool by ELISA or rapid test. You have rapid card test available for toxin A and toxin B. If you have both this positive, A and B positive in rapid card test, you can find out that this particular bacteria is toxin producing. Why this is important is difficile can be a normal commensal. So if you can culture and isolate difficile from stool, it doesn't prove that it is pathogenic. If you want to prove the pathogenicity, you have to show that this produces toxin A and toxin B. So you can directly detect the toxin production in stool by ELISA or rapid card test, or you can go for a molecular test like PCR and detect the toxin coding genes. That is how you do. And how will you treat difficile associated colitis? You can give metronidazole. It's a very good drug. Otherwise, in severe cases, you may have to give vancomycin. So basically, you have to control the use of antibiotics, stop broad spectrum antibiotics at the earliest, ensure hand hygiene. Difficile can be carried between patients by the hospital staff. So hand hygiene is very important. Isolation of patients who are diagnosed of difficile, you have to isolate because they can transmit the infection to others. So this is how you prevent Clostridium difficile infection. So both botulinum and difficile can be asked as short notes. So don't forget pseudomembranous colitis or antibiotic associated colitis is caused by Clostridium difficile. So the important questions: botulism, botulinum toxin. It's a very powerful toxin. Remember, it's a neurotoxin. Pseudomembranous colitis or Clostridium difficile. These are the probable questions from this part. Thank you.